I was here at 6:30 this morning, and that case didn't start until 9. So we were getting the patient at about 8:30. So for an hour and a half to 2 hours before that, it was trying to get equipment in there. Thank you. One surgeon will use one piece of equipment, another surgeon doesn't like it. He wants to use something different. He wears 8.5 Dermagard and then an 8 standard over top. Okay. As a circulator, you're the patient's advocate. I have an arm board. Try to make sure they're comfortable. We use the foam. We will pad any bony areas like the bottoms of the heels, the elbows, right in the wrist. And make sure if you didn't pad the wrist and they laid like this for a lengthy surgery, you know, you don't want them to wake up with other aches and pains from laying on an OR table.
Do you have it in here?
We did an arthroscopic procedure on a shoulder.
I see right there, that's the ball up on top.
Once the surgeon got in and looked at the joints, decided that he needed to open the shoulder, that he could not fix it arthroscopically. I need lots of positioning help, lots and lots. We're not coming out, we're going supine. I need lots of positioning help. People come out of the woodwork and they want to help you any way they can. We're all here for the patient. We're all here to help any way we can. I like it a lot. I can't imagine doing anything else. Not only are you proud of yourself, your family is proud of you, your children are proud of you. It makes you feel good.
My goodness, good morning. How is the little fella this morning?
To me, nursing is what it's all about.
Oh, gracious, let's get you all fixed up this morning.
Sean's our little guy that came in with fever, vomiting, and diarrhea.
Let's just listen, okay?
He's a lot of fun to take care of because when you talk to him, he responds to you. He smiles and he coos. He likes to be held. We've now decreased the IV. When we came on, it was running at 30 cc's an hour. We've now knocked it down to 10, which is maintenance for him, and we're going to start giving him his PO fluids a little bit more frequently to see if we can get him home.
Oh, goodness, you're a big fella. That a boy.
There we go. Okay. Jonathan is our little fellow that came in with pneumonia, and he has a history of asthma. He's getting updraft treatments, which are breathing treatments to help open his lungs to clear them.
Yeah, you're a good fella, Jonathan.
Jonathan, did you pull your bracelet off your foot?
Yeah.
Don't do that. We have that on so nobody can take you away. He's 3, very inquisitive, wanting to know what everything is and what's going on and what it's all about.
Who are you talking to on the telephone? Anybody important?
There's nothing greater than kids. They come in, they're so sick. You start an IV on them within 24 hours, they're a total different. And I don't know, they're just appreciative in their own little way.
Did you hear that noise out there? Did that because you took your bracelet off.
I thoroughly enjoy nursing.
As soon as our flights are called in, we're supposed to be off the ground within 10 minutes of receiving flight. We'll fly up to a 100-mile radius, and so we go up to Gainesville. That's a 45-minute flight right there, 48-minute flight. So that's a long time to be with a critical unstable patient. So it can really be real stressful. You have to always be thinking ahead. A lot of times on the floor, or even in the ER sometimes, you can react to how the patient's behaving. But here you have to anticipate what's going to happen, what that patient's going to do. You have to actually plan on the worst and hope for the best. What if this happens? What if this patient starts to code? What am I going to do? In an ER, you've got lots of room and lots of hands. In a helicopter, you've got a small space. You're doing it all yourself. It's fun when you have patients that don't require a lot of maintenance. They're easy. They just sit back, and we don't get many of those anymore. We're getting fewer and fewer of those. We get a lot of patients that come with balloon pumps and are on ventilators and multiple drips. So that takes a lot of both your RN and your RT who are working together. Takes a lot of just concentration.
Marty, you're needed to the code room, please. Marty, to the code room.
EMS called us and told us we had a patient that had a heart rate of 30. Well, that's not really conducive to life, or at least not very good life. So what we're going to do is we're going to just get my portable pacer set up. Good. He's got enough medications there. How you doing?
Keep the drugstore busy.
Yeah, I can see that. The fun thing is that this guy is alert and oriented and knew exactly what he was doing. He was fun to talk to. Okay, this is Mr. Zepp. Okay.
He was ALS. He was ALS. And when we ALS him, his pulse started. So we said, we need to get this down and checked out. No altered mental status, no shortness of breath, chest pain, or abdominal pain. Blood pressure is good at 150 over 90-ish.
Doc wants to know what's his heart rate.
That's what we're looking at right now. If you look at a monitor, you'll see that his heart rate is in a third-degree block, which basically means that it's kind of firing off on its own. The slower it fires, the less blood that's actually flowing, which goes too slow, then you don't have any blood going to the brain or to the important organs of your body. We were surprised. You always expect the worst, though. That's what you're supposed to do, and then be pleasantly surprised when someone comes in and they're talking.
Do you have any shortness of breath, any problem whatsoever right now? No, nothing. We're not going to give him blood pressure. Has been holding fine.
Okay.
Asymptomatic. We'll just keep it on the side just in case we need.
You want some fluids on him? A lot of times, the patient comes in either in the ER or on the helicopter. They come in, they're in distress, and you can affect the change right then and there. You can see the difference. There's a major reward I get just from looking at people and seeing that, hey, I made a difference in that person's life.
It's after 2 days of outbreak.
Yeah. I always wanted to be a nurse when I was little. I thought, nurses in white uniforms and caps were the neatest thing going, and to help people, that had to be special.
It sometimes breaks out for us after I eat tomatoes.
Okay, were there tomatoes in your sandwich?
No.
Open it, let me look in your mouth. The first 15 years it was hospital nursing, and I worked obstetrics, surgery, and for the last 17 years it's been extended care, and I find this more rewarding. This is like a college dorm senior citizen style. Is your appetite okay now? This is their home, but when they get sick and they end up in the health center, it's still their home. And you become the daughter that's not there. Okay, let me listen to your lungs. They come down because they are needing something done. They can't put their eye drops in. They can't change their bandages. Some people want the advice of a nurse before they talk to their doctors. Thank you. Okay. I love you. Love you too. Really. Bye-bye. A lot of it's maybe just a pep talk. Listen, best medicine's a hug.
I just checked her, and she's 5 to 6. Did you attend a Lamaze class at all? She's progressing. A little bit slowly, but she's progressing. So just increasing her Pitocin. And take a big breath and push right down into your bottom. That's it, girl. Keep pushing, keep pushing, keep pushing. Come on. Push down hard. Come on, push hard, hard. Most fun is, I think, pushing. I really enjoy it because the moms really seem to get a second wind. They're tired, they're exhausted. Then when you check them and they're completely dilated and the baby's down and we start pushing, it seems like they just come alive. Okay, take a break. Take a big breath and do it again. Right back down into your bottom. and it's really exciting to watch the dads and, you know, grandparents and whoever else is in the room. It's fun to watch.
She pushes well, eh?
Yeah, she sure does.
Yeah.
First time mom.
Like a little pro.
Help them in one of the most exciting times of their life, bringing a baby into the world. And it's just wonderful, I think. Push. Pull back on your legs. And push down into your bottom. Come on, push down, push. Bring that baby down. Come on. Atta girl. Come on. Good job. Hold it down there. There you go. You want some more mineral oil? Yeah. Take a breath, hon.
Take a deep breath
And do it again. Push down into your bottom.
Good.
Good job. Oh, excellent.
Good. Lots of hair on the baby.
Oh, yeah.
Lots of pressure.
Chubby cheek.
Nobody calls on the neck.
It's a girl.
It's a girl. Yeah. 12:39.
You lose.
Yeah. I can't imagine ever doing anything else. Happy birthday. Yeah. It's been wonderful for me.
Oh, I got mommy's feet.
You got mommy's feet. Now we're going to kind of listen to your heart. Do you smoke?
My pleasure right now at my lifetime is to volunteer. And if I can help one person one day,
Now breathe.
it pleases me. Mr. Cheney lives in the woods. I had no opportunity to meet him prior to this. He came in today because he had bumps and lesions all over his skin, and he was itching. And that diagnosis was fairly simplistic. Did you drop something on your foot because they're purple?
No, not to my knowledge.
However, when he got down to his extremity with the bump on it that I could not identify, and he had not had a fall or trauma, your only option is, in my feelings, to get an x-ray. Also, I think we probably should get some lab work on you and see what's causing this bruising down here, since you haven't dropped anything on your foot or fractured it or injured it. You didn't jump down off of anything and hurt yourself? Okay. I think that probably we should just get an x-ray from like here to here. And the other foot is normal?
Right.
Doesn't have this problem? Okay. And then we'll get some lab work, so that way we'll be looking at the inside of you in all directions. Any kind of bump that occurs on the body that's not like a dermatology thing, you really need to start moving in depth. You've got to target what you can while you can, because he will go back to the woods in his own lifestyle, and this may not be critical, but if it is critical, you don't want to miss it. The x-ray report on Mr. Cheney, do you have it? I had my associates first, and then I got my bachelor's, and then I had an opportunity to get my master's in nurse practitioner. Actually, I didn't get into it till later in my life. I wasn't sure what I wanted to do after a marriage had ended. And so I started from the very beginning and worked all the way to what I consider, at my age, the master's, which is a wonderful gift I gave to myself. And that's what nursing is, a gift you give to yourself.
Okay, on his ankle, where is the...
It's a lesion up in this area.
So nothing shows up there?
So it's probably skin related?
It's probably skin related.
So this is his first visit. So I don't know if you'd want to do any lab work on him. He definitely has this.
Has scabies? Okay.
Yes.
And you will be just doing a CBC. That's a good idea with the chem profile. And then just have him come back in a couple of weeks.
So I'm going to start him on Keflex for that lesion.
It looks like
You don't ever wrap anything from here down. You wrap it from here up, okay, and go above the lesion, okay, above to at least here, and then put your clips on. So go one.
I'd like to think that one day I help somebody, and then maybe somebody will help me.
All right, and then we'll get you some medicine, and then we'll get you some lab work.
What we're going to do now is we're going to flip you over onto your back, and we're going to take a look at the front side. You might need to put a drain in front, okay?
I'll be giving you some medication to help the procedure run smoother, you know? A typical day from 8 to, let's say from 8 to 5 is non-stop. We're going constantly. We do all kind of different procedures, never the same. We do cerebrals, we do carotids, we do abdominal runoffs.
Anything from arteriograms to what we did earlier, which was an abscess drain.
That involve using an ultrasound machine to look for the right spot, and then you use fluoro also.
Okay, here we go, my sister. Some more pain medicine, okay? You've been doing great.
Once they see the spot, they put a needle in there until they can get into the abdominal cavity where the abscess is at.
Okay, you're going to feel some pressure on your belly here for just a second, okay? A little pressure. All right. That's one. Okay.
And they put a wire, a guy wire.
Just a couple more and that's it, okay? You're doing great. Pain medicine's going to work here in just a couple of seconds.
And then once they spot it, then they take dilators, and they dilate to find out what kind of size irrigation tube they're going to put on.
There we go, last push.
They drain through a syringe.
It hurts? Okay.
Most of the procedures we do back here happen to be very painful. So, of course, you have to keep them within that limit of being somewhat awake but not very uncomfortable.
I'm going to give you some more pain medicine, okay?
What kind of medication? It's a relaxer, but it's short-acting. It's conscious sedation, so they're awake through the procedure. My responsibility is totally is the patient. Make sure he's breathing. I monitor his vital signs, blood pressure, the O2 sats, his heart rate.
You really have to know what is it that you're doing and know your patient to see how well they're going to do. Every now and then you get a little surprise.
Sometimes when they're doing carotids and cerebrals, they can bradycardia on you. They can have a stroke too on the table. So you have to know what you're doing. You did well. It's always painful when you help people out and you know that you could relieve their pain or you could alleviate their situation, whatever the situation may be. It makes you feel good.
Every day you'll get to see something different. It's never the same thing over. I mean, every day is different.
My background is respiratory. I am still a respiratory therapist. And then I transitioned over to nursing, and I've been doing this for a year. What are you doing in there? It looks like she just stopped breathing. Whenever she slows down and then eventually she'll like stop, her heart rate will drop. I stimulate her, I just kind of rubbed her back. Sometimes we flick their feet or rub their butt, but I pretty much just went up and down her spine real lightly, you know, just to give her a little stimulation. And you could see she was kind of like wanting to come back, and then she kind of slowed down again, and she actually stopped again. See, I'm sleeping so hard. I forgot to breathe. I did turn up her oxygen a little bit. Don't want them to go too long without oxygen. We're with them at their bedside 12 hours a day, and we are their voice. And you can read their body language, and I can translate that to the physician. I feel like I found my calling. She just decided to make sure I was still standing here.
At first, when the trauma patients come in, you set them up on a monitor and assist the doctor in anything that they need at the time. We do 12-lead EKGs and draw blood and splint, broken bones. Having a fast-changing environment where you're constantly doing something to better a person's life is what gets me. We're just going to put you on the monitor, hook up a blood pressure cuff. After I got my bachelor's degree, I went to EMT school at Valencia at the East Campus. And then from there, we did clinicals in the ER, and that's when I knew that I needed to work in the ER. I had like 30 hours I had to spend in the ER, and I got in there and thought, oh, I really need to do this. I need to go back and get my nursing degree so that I can work in the ER. At first, I thought I was never going to finish. I thought this, like I came from U.S. and I got here, and I thought this is a whole other story here. And
I thought that I could kind of just breeze through these 2 years, and that's certainly not the case. It's been very competitive, and the instructors have been very, shall I say, not hard, but they have stretched you academically, and that to me makes me feel good about the nursing program.
Well, they've got to do anatomy and physiology 1 and 2 and micro, so that's going to take them a year, plus all the other general ed. So I would say the average time for a student here is 3 years.
Every invasive procedure that they'll get the opportunity to do in the hospital, they do here first on the mannequins before they go to the hospital to try to do it on a real live human being.
Would you prefer the injection in your abdomen or your arm?
The mannequins that we use are absolutely fabulous. The students can hear heart, lung, and breath sounds. They can start IVs. They can give them injections. They can put tubes down their noses. There's really not much on the mannequins that they can't do that you would do to a real live human.
Once they've learned all their skills, which they do in the first semester, they then go out into the hospital and begin to take care of patients.
We're assigned to one mom and baby. I will show you how we wrap her. And what we do is we go in and assess the mom, and then we also do an assessment of the baby. And then after that, we just sort of see if she needs anything. Sometimes they want to just be left alone. Sometimes they want the baby to go back to the nursery. But you take this really snug. Don't be afraid to pull it snug and sort of tuck it underneath here.
Okay. I work on the surgical floor, and so after surgery it's important to walk, and so I help them walking, and I also help nurses with any procedures they need to do.
Anytime the student does any procedure in that very first semester that they go to the hospital, there is a clinical instructor there with them. So it's very supervised.
In clinicals, they're right there to help you, with your task at hand. If you didn't quite understand, they were there to teach you and explain why you're doing this.
Valencia nurses are sought after first, and I don't think it would discredit the other programs at all, because I think they have a good product as well. But we seem to have developed that reputation over time.
They've seen what our graduates can do. They know what our product is. They know it's a good product. They know they can go out and begin to practice with very little orientation.
Before they even begin to graduate, they're being offered jobs.
I'll either be working at Health Central or Orlando Regional Healthcare.
I have a job at Sand Lake or RHS Sand Lake. I'll be working in the PCU department.
It was a great program, and it helped prepare me for the exam, the NCLEX exam, and I felt very prepared, especially being in the hospital and doing clinical work as well. I felt comfortable, and I was ready to be a nurse after I graduated from Valencia.
I think they better prepare their nurses to come out here and work. It's a very intense program, and they don't just let you slide. You need to know your staff to be able to go and continue on. So yeah, I'd recommend Valencia. I'd do it again with them.
I was not out of school very long before I was already a charge nurse. I mean, we're talking about like 3 days, and I was a charge nurse. And I think because of the background that I had at Valencia made me able to do that.
Nursing, I think, is the opportunity of a lifetime.
Not only is nursing a profession, but it's a calling.
I don't think there's ever a day that you don't go home and say, wow, I did something. I did something good for somebody.
You touch, either directly or indirectly, so many people's lives.